What happens to your body when you get coronavirus? Coronavirus is an infectious disease which is caused by the newly discovered coronavirus. Most infected people don't need any special care and experience only a moderate respiratory illness. Older people who already have medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to face some serious illness. Coronavirus is mainly spread due to saliva droplets, nose discharge, coughing, and the infected person sneezing. So you can protect yourself and others by simply washing your hands and always making a small distance from others. An alcoholic-based solution for rubbing your hands is also helpful, but don't touch your face.
Hi guys, welcome to Top News Age. Hit subscribe and press the bell icon to get notifications from Top News Age. Today we're going to look at...
Let's see what happens to your body when coronavirus infected you.
Let's get started. At number 10 we have...
Affect your lungs. Coronavirus also affected your respiratory system. Like the SARS virus and MERS virus, your lungs are first affected by the virus, including fever, cough, and shortness of breath. Some people only have minor respiratory symptoms, which others develop some serious life-threatening issues. But there is a subset of people who seriously face lung damage. This damage leads the patient to the leakage of fluid from small blood vessels to the lungs. Recent reports suggested that coronavirus affected the lungs similar to the SARS and MERS virus. Usually, a COVID-19 patient starts facing difficulty in breathing within 5 days after showing the symptoms. Lungs-infected patient treatment involves the increment of oxygen into the blood through supplement oxygen and mechanical ventilation.
At number 9 we have...
Affect your stomach and intestines. Many people also experience stomach and intestinal disorders during the coronavirus infection, which include nausea and diarrhea. Although these symptoms are not much common as lung issues, many infected patients are still reported to have gastrointestinal symptoms. A virus can enter the body through the lungs, and the intestines are not out of reach for these types of viruses. Recently, researchers take samples of the stool for different COVID-19 patients, but they're not sure about the virus's fecal transmission yet.
At number 8 we have...
Affect your heart and blood vessels. Your heart and blood vessels can also be affected by the COVID-19. A coronavirus patient may experience irregular heart rhythms, lack of blood in tissues, and low blood pressure. However, the researchers are not sure about the direct damaging to the heart by coronavirus. It is reported that 44% of the hospitalized patients in the ICU had irregular heart rhythms. It is also reported that COVID-19 patient blood clots move quickly, which increases the risk of stroke and heart attack.
At number 7 we have...
Affect your liver and kidneys. A damaged liver leaves a higher amount of enzymes in the bloodstream as compared to normal liver. About 27% of the COVID-19 patients hospitalized in Wuhan had kidney failure. Many COVID patients had acute kidney damage and required a kidney transplant urgently. Even during the SARS outbreak, scientists found that the virus was found in the kidney's tubules. Still, there is no evidence that the coronavirus causes kidney injuries.
At number 6 we have...
Affect your immune system. Whenever any foreign virus or bacteria infects your body, your immune system responds to attack it. The immune system produces the cytokines to recover the infection, but it can be damaging to your body if the body releases too many cytokines. Most of the body damage during the COVID-19 is due to the complex immune system reactions. The infection itself generates an intense inflammatory response, which can affect the functioning of multiple organ systems. It is also reported that children experience less illness than adults, and maybe it's due to their straightforward immune response.
At number 5 we have...
Symptoms of COVID-19. Doctors are learning new things about the coronavirus every day. And so far, many patients don't show any symptoms during infection. May you carry the virus for the last 2 or 14 days, you don't have any symptoms. Some common symptoms linked with COVID-19. Shortness of breath, cough, low-grade fever that increases in temperature gradually, chills, fatigue. Less common symptoms of COVID-19. Sore throat, headache, muscle aches and pains, loss of taste, runny nose, diarrhea, nausea, and vomiting, discoloration of fingers, pink eye, rash, repeated shaking with chills. These symptoms can appear in 2 or 14 days after the infection, as the incubation period of coronavirus is 14 days. Fever is at the top of the coronavirus symptoms, but according to the American Medical Association, 70% of the coronavirus-infected patients don't have a fever during infection. Cough is more common, as almost 68 to 83% of coronavirus patients face coughing issues, and only 11 to 40% of the patients have shortness of breath. Other less common symptoms are confusion, headache, nausea, and diarrhea. It is reported that 81% of coronavirus cases were mild in China. Call the emergency quickly if you face any symptoms, including trouble in breathing, blue lips, blue face, persistent pain, pressure in the chest, confusion, or excessive drowsiness.
At number 4, we have
COVID-19 and pregnancy. COVID-19 complications are increased for pregnant women, which can put them at a higher risk than non-pregnant women. A pregnant COVID-19 woman has 3 times more chances of getting into the ICU than a non-pregnant COVID-19 woman. COVID-19 pregnant women more likely to have a preterm birth as compared to non-COVID pregnant women. Some recent reports claim that the coronavirus doesn't transmit from mother to child during pregnancy, but the virus can infect the newborn after birth.
At number 3, we have
How can coronavirus be diagnosed? Coronavirus can be diagnosed using blood, saliva, and tissue samples, like many other viral infections, but most of the coronavirus tests use a cotton swab to get a sample from your nostrils.
At number 2, we have
COVID-19 treatments. Currently, there is no cure for this new virus, but many treatments and vaccines are under study. The FDA approved the first COVID-19 treatment, the medication Remdesivir, on October 22, 2020. In November 2020, the FDA also approved the monoclonal antibody medication, the human-made proteins that help to fight foreign viruses. Other COVID-19 treatments include antiviral medication, breathing support, steroids to help, and blood plasma transfusion.
At number 1, we have
COVID-19 prevention tips. The best way to prevent the COVID-19 spread is by avoiding contact with people showing the symptoms or having any respiratory infection. The second important thing is the making of 6 feet physical distance from others. Let's some other prevention tips. Use warm water and soap to wash your hands for 20 seconds. Don't touch your face, eyes, and mouth when your hands are dirty. Don't go outside if you have any symptoms of fever, sick, or flu. Don't cough openly. Cover your mouth with tissue or elbow during coughing or sneezing. Use a disinfectant to clean out the regular touching objects like phones, computers, and doorknobs. Some common symptoms linked with COVID-19: shortness of breath, cough, low-grade fever that increases in temperature gradually, chills, fatigue. Less common symptoms of COVID-19: sore throat, headache, muscle aches and pains, loss of taste, runny nose, diarrhea, nausea, and vomiting, discoloration of fingers, pink eye, rash, repeated shaking with chills. Let us know in the comments if you or anybody from your family got the coronavirus.
Hope you enjoyed our video. Please like, comment, and share it. See you all in the next one. Thank you. Bye.